Try this. Rotate your hip inward without your lower back moving. This is something that you cannot do. Your deep hip rotators are weak, and it's likely why your hips keep locking up. And if you suffer with chronic low back pain, knee pain, hip pain, or you have pain or discomfort after sitting, then these are exercises you need to be doing regularly. The deep hip rotators play an important role, and they are the most neglected muscle groups when it comes to exercise. Now, why are they so important? Well, for one, the deep hip rotators are your shock absorbers. So that means every time you take a step, they stabilize the femoral head in the socket. And when these rotators get weak, that ball doesn't sit cleanly anymore. So it starts shifting, grinding, and wearing down the cartilage. And if nothing is done in order to correct this dysfunction, eventually it turns into impingement, labral tears, and arthritis. Secondly, weak hip rotators can lead to knee pain. So when our external hip rotators are weak, your knee starts to cave in every time you load it, whether you're squatting, lunging, walking, or running. And that inward collapse called valgus knee collapse is one of the biggest hidden drivers of patellofemoral pain, IT band syndrome, and even ACL injuries. So if your knees are hurt, there's a high probability the deep hip rotators are the cause. And lastly, weak hip rotators can cause chronic low back pain. So when your hip rotators can't control rotation properly, your lower back has to step in and do the work every time you walk, twist, or change direction. And that's why chronic low back pain sufferers almost always show measurable hip rotator weakness, especially on the side that hurts the most. This is why strengthening those rotators is so important, because it'll allow your lumbar extensors to finally rest. And as a result, the back pain starts to fade because you took the load off of it. Now, for these exercises, the important thing to understand about hip rotation is that when the knee is bent and we bring our foot inward, our hip is externally rotated. When we bring our foot outward, our hip is internally rotated. This can be confusing. Now, when our knee is straight and we point our foot outward, our hip is externally rotated. And conversely, when we point our foot inward, our hip is internally rotated. So it's the position of the knee that determines whether our hip is externally or internally rotated. Now, regarding sets and reps, shoot between 15 to 20 reps for 2 sets of an internal and external hip rotation exercise. I don't recommend doing multiple exercises at a time. Make sure you primarily are feeling these exercises in or around the hip joint itself. And you'll also want to use a lighter resistance because these muscles can get fired up pretty quickly. If you need resistance bands and or a foam roller, check the links in the description. They are located there as always. Now let's get started. All right, we're starting with seated banded internal hip rotation. Now with these rotation exercises, the most important thing to focus on is keeping your knee in alignment. So notice how my knee remains in line with my hip. This will ensure you are rotating at the hip rather than doing hip abduction. The band will be around the foot and you're going to pull the band outward. Okay, so your foot's going to go outside of your hip. That is going to be internal hip rotation. Now we have it on the inside leg, so we're doing external hip rotation here. So band is still around the foot and we're pulling the band inward this time. Okay, so bringing our foot inward, keeping that knee in alignment with our hip. All right, now we add the foam roller between the knees. So we got the same internal hip rotation here, but this time the foam roller is going to help us keep those knees in alignment. So if you do struggle with keeping that knee in position, this is a good alternative. And this is the external hip rotation with the foam roller between the knees. And here's another variation. Okay, we're pulling the band outwards, so we're getting that deep internal hip rotators. It is with a short resistance band, so if you don't have a long resistance band and you have a short one, this is the variation you're going to want to do. All right, now we're laying on the side, so side lying internal hip rotation. Now this might not be the best version for those of you that have lateral hip pain or discomfort. because you're laying directly on the hip. But with this exercise, you keep your legs in line with your torso. The foam roller is between the knees and the band is around both feet. And you're bringing your foot that's on top outward. All right, now we're doing internal hip rotation from the prone position. So we're laying on our stomach, the band is around the foot, and we're pulling the band outward. The most important thing with this exercise is don't sway or rock your whole body. Make sure you do this movement under control. I don't have it demonstrated in this video, but you can also place a foam roller between your knees as you're doing this one. And here's another angle of that exercise. Sorry for the view. And now we have external hip rotation. So it's going to be on the inside leg when we do our external rotation. Same position for the band, and we're bringing the band inward. Don't forget, after doing internal and external rotation facing this direction, you got to do it facing the other direction as well. So you got to flip over and do the same exercise. Okay, this always confuses clients, but make sure you flip and do the opposite way. All right, now we're on to supine banded internal hip rotation. So we're on our back, resistance band is around both feet, the foam roller is between the knees, and we're bringing our foot outward while keeping the knees in contact with the foam roller. Keep in mind with this version, it may be challenging to keep your legs held in this position. So I do recommend trying the Sidelying version first before doing this one. All right, now here is a standing version of external hip rotation. Okay, so the foam roller is going to be placed vertically against the wall, and you're going to put your bent knee towards the bottom of the foam roller. Okay, that's important. Then you're going to start by touching the wall with the outside of your foot and bring your foot in as far inward as you can. Now, keep in mind, you're getting both internal and external hip rotation with this exercise, but the emphasis is on the external hip rotation. And you could also at some point add ankle weights to this exercise as you progress to make it more challenging. All right, now we're doing the standing internal rotation here. So this time we're going to place the inside of our knee towards the bottom of the foam roller, and we're touching the inside of our foot to the wall and bringing it out as far outward as we can. You can hold the foam roller in place with your hand if needed, and same for external rotation. You can always add ankle weights to make it more challenging as you progress.